So today I would like to talk to you about rotator cuff tears. So the rotator cuff is a collection of muscles around the shoulder that help do certain functions around the shoulder. It's something that is very, very common. It's something that we typically see in patients usually in the age group of 50 to 70, sometimes older, sometimes younger, but that's certainly the most common time frame. It can be from any number of causes. Broadly, it's usually one of two categories, one being acute, one being chronic. In the acute setting, it's usually from, a patient has a fall directly onto the shoulder, or they're starting to fall and they reach out and grab something like that. They usually feel and hear a pop in the shoulder, they feel pain. The kind of hallmark of it is that they have a lot of difficulty raising and moving their arm. The chronic setting is usually more of a degenerative type thing, and that's, someone who uses their arm a lot, typically a lot of overhead activities. A lot of times we have overhead athletes that come see us with this type of thing. Looking at the anatomy of the rotator cuff. The rotator cuff broadly is four different muscles. The muscles turn into tendons, and then the tendons attach to the bone. They serve different functions. You have one in the front, one in the top, and two in the back. The one in the front is called the subscapularis, and that typically helps with internal rotation of the arm. That one is one of the least commonly injured ones. You have one in the top, which is called the supraspinatus, which helps lift your arm. That is the most commonly affected rotator cuff tendon that's injured. You have two in the back. One is called the infraspinatus. The other one is called the teres minor. The teres minor is very rarely ever involved. It's usually the infraspinatus, and that helps with external rotation of the arm. The main function of the rotator cuff actually is to keep the ball in the joint, as other muscles around the shoulder help move the arm, so the deltoid and things like that. So the primary function is to keep the ball in the joint as the other muscles move the arm. Secondary functions help move the arm a little bit as well. When you've injured your shoulder, typically when you come to see me, the first thing we'll get is an x-ray. X-rays will sometimes help show certain things that are associated with more chronic rotator cuff tears. So for instance, if you've had a rotator cuff tear for a number of years, you start to develop some arthritis in the shoulder, and the x-ray can certainly show that. If you're having a lot of pain, a lot of issues lifting your arm and moving your arm, and a lot of weakness around the shoulder, a lot of times we'll get an MRI, which helps show us the details of the rotator cuff a lot better, and that'll help diagnose any tearing that might be there. In the acute setting, we'll see very characteristic things on the MRI. We also couple that with your history of a fall or something like that. And typically acute rotator cuff tears do need surgery. That is certainly a discussion that we have as far as surgical versus non-surgical management. When it comes to chronic rotator cuff tears, most often those are treated without surgery unless the non-surgical means do not help with your pain and don't help with your function, in which case surgery could be an option at that point. When you're talking about acute rotator cuff tears, and you're talking specifically about surgery, the surgery that we do is an arthroscopic surgery, meaning a couple small incisions around the shoulder. It's done with a camera and specialized minimally invasive equipment. Typically what we do is we place a couple anchors into the bone. So the supraspinatus is typically the one that's most affected. So typically what we will do is we'll put a couple anchors into the bone here, 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 and then the anchors have suture, that the suture gets passed through the rotator cuff, and then you tie it down and it brings the rotator cuff back down to the bone so that it can heal. You'll be in a sling typically for 4 to 6 weeks, followed by fairly intensive physical therapy for about 2 to 3 months. Depending on the location of the tear, the size of the tear, it may be, any as quick as 2 months before you're kind of back to your normal daily activities. Sometimes it takes 3 to 4 months. When it comes to chronic tears, depending on the location, the size, the muscle bulk, because when a rotator cuff tears and it tears completely off the bone, over time the muscle starts to shrink, and if it shrinks too much, it might not be repairable. But if it's, depending on how it is, we might be able to repair it in the same way. Sometimes we have to do some extra things to get it to go back over to the bone and do a primary repair. Sometimes it might not be repairable, in which case we do other things. There's capsular reconstruction, where we kind of reconstruct the entire tendon. We can do what's called a balloon spacer, which is we put a balloon in the space. There's other tendon transfers we can do. We can get tendons from other parts of the bodies and put them in the place of the rotator cuff to be able to serve a similar function. And then in the chronic setting, where enough time has passed that you start to develop arthritis, then typically in that case we do what's called a reverse shoulder replacement, where the shoulder is a ball and cup joint. We remove the ball and we remove the cup, and then we switch the two. So then the cup now becomes the ball, and then the ball now becomes the cup, and this is how it looks. So the ball, which used to be here, is now the cup, and then the cup is now the ball, and then your arm rotates. And the reason behind this is, and the reason that you reverse the two, is that it allows the other muscles that we talked about before, like the deltoid, to function a lot better and moves your arm for you. Similar to the recovery for the rotator cuff repair, if your rotator cuff is not repairable and you have some arthritis and we have to do the reverse shoulder replacement, it's almost the exact same recovery time frame.